School districts continue to send out their plans for the return of school. Many parents, administrators, and teachers want to know, should they be back in the classroom? Should their children be in the classroom? Some doctors say the answer is yes. The president of the Indiana chapter of the American Academy of Pediatrics is Dr. Emily Scott, joining me live to answer some questions about reopening schools for the well-being of our youth. Doctor, good morning to you.
Good morning.
Hey, let's talk first about, I know this is not just an easy thing to get to in 3 minutes, but what is the stance from the Academy, if you can explain it that way?
So we really believe that all planning should be focused on the goal of having children in school. We know that in-person education for children is not just good for their academic health, but it's really important for their social and emotional health as well.
Let's dive into that a little bit more. We have these different aspects, a lot of fear right now. A lot of parents have a lot of questions. Let's start with the child themselves. We've heard a lot about it not being safe. We've also heard the side of looking at just in Indiana, for example, one child under the age of 18 has passed away, one, compared to other numbers of deaths. One number too many. But what do you say first when it talks about how COVID-19 affects children?
You know, what we know, and we're learning more every day, but we know that children don't tend to be as infected as often as adults do. And when they get disease, it tends to be quite a bit milder. We also know that children don't tend to transmit it as much as adults transmit it to each other. So while absolutely one death, is way too many, we know that overall most children who are affected with COVID do actually very well.
So then you're going to say, okay, well, but then if kids can maybe get it, even if they don't spread it that much, they still can spread it. When it comes to principals, teachers, administrators, is the fear, though, that the virus will continue to spread if we open school? What do you say to those folks?
We certainly understand the fear of opening schools back up from everybody's perspective, but I think we have to balance that with the fact that we know that we can do certain things to make it safer to open schools. So we know that mask wearing, particularly among adults and the older children, is really important. Social distancing when possible, keeping groups smaller, minimizing traffic in the hallways for kids. We know there are things that we can do to minimize the risk of spread in schools. And we know that we have to balance that with the really real dangers of having kids out of school as well, in terms of kids not being supervised in the home, having increased cases potentially of abuse that are not being picked up by the school district. And we know that 1 in 7 kids lives in a household that's food insecure. And sometimes the only healthy meal a kid gets during the day is the meal they get at school.
And it might be because my mom was a therapist for more than 3 decades, but the mental part of this is something that I really think about and consider. I see a lot of teenagers, drug abuse, alcohol abuse, cutting themselves. Tell me a little bit about the mental aspect of teenagers.
We know that it's really important for teenagers to have that outlet with their peers in school. We also know that our schools do an amazing job of picking up on some of those signs of depression. They see the kids day in and day out. They're able to offer mental health resources within the school district. And so I think that is not a risk that we need to, that we can't think about as well.
I know we're out of time. I know there are other parents, though, that have younger students. They say, my kid won't be able to wear a mask. Maybe someone who has a child who has a special need. Quickly, what do you say to them that says, you know what, they might not be able to follow the rules or the guidelines?
And I think that in younger kids, that may be okay. And so I think that the American Academy of Pediatrics has put out some guidance that we, need to, offer mask breaks and for younger kids, especially when they're not known to spread as much. But what I would tell parents right now is to do what I'm doing with my kids at home. You've got to practice mask wearing, and adults have to model that as well and act like they're okay with it too.
Dr. Scott, the president of the Indiana chapter of the American Academy of Pediatrics, we appreciate you joining us with your opinion this morning. Thank you.
Thank you.
Absolutely. We'll be right back after a quick break.